Block. I'm a Derm PA in Chicago, Illinois, and I welcome you to the Derm Dispatch series for Dermatology Times. I have Brittanny Groover here. She is a melanoma warrior, a survivor that has created an advocacy platform on social media. She is a force in regards to sharing her journey and her story about her melanoma diagnosis. And I'm sure saving a lot of lives because of the information that you provide. Brittanny, thank you for joining me. Welcome.
Thank you for having me.
Absolutely. So, the general story background of your diagnosis, and when you received it. So, I want to hear about that and I want to share it with our listeners. And also, I want to know, did you notice a spot or is this someone else?
My story is pretty unique because I was born into the cancer community, I guess we can say that, during the pandemic. So I had spent my teenage years being heavily addicted to the sun. I can just, for as long as I can remember, my mom loved tanning. And so I just kind of followed in her footsteps. So her and I, growing up, I was sort of in a single family home in a way, not by choice. My father was diagnosed with MS when I was born, and he sadly passed away from it when I was 12 years old. So from that time on, it was just me and my mom. And a lot of things that we like to do together was swim in our pool that we had in the backyard, lay out, get the best tan. We started going to tanning beds whenever I was a teenager, tanning salons. And so once I became a young adult, I saying that life is serious and I probably caused a lot of damage to myself as a teen, I started going to skin checks. And every year in my young adult, like probably from 21 to my diagnosis, I went to skin checks every year. But I had never had anything come back as anything. I had one biopsy during that entire time and it was clear, and that was it.
So let me
Um,
ask you,
yeah,
what prompted you to go to a dermatology clinic and get a skin check?
'cause, there wasn't any like moment other than I did get pregnant whenever I was 21, and I actually got to have health insurance because of that for the first time in my life. And so I started kind of like thinking, wow, I have health insurance. Maybe I should schedule like appointments with people. I can. And one of the first things that I decided to schedule was a skin check. And I think it was that guilty conscience because I knew I had grown up tanning. I was still tanning. I did not tan, but I must have heard somewhere along the way that skin cancer is actually kind of serious. And
So let
so,
me ask you, Brittany, because you knew tanning was bad for you,
yeah,
right?
yeah,
Did you continue to tan after you
yeah,
still went for your annual
yeah.
exams?
I did. It was that don't it won't happen to me complex, you know?
Okay. So the
Yeah.
education you received at the clinic, what did you do with it? Obviously, because that is something that we do in the clinic. We say, "Hey,
Yeah.
stop that tanning." And
Yeah.
it's hard because it's an addiction, right?
Yeah. Yeah.
And did
It is.
you cut it down at all? Did
No.
you say, "You know what? I'm going to stop indoor tanning"?
No. No. The only reason why I really stopped indoor tanning is because it was getting pricey and I was a young mom. So instead of indoor tanning, I just converted to a chair in my backyard that I bought purposefully so that I can get up every morning at 8 a.m. and lay out in the sun
So
so I
how
can get a
long
free
would you lay
tan.
out? How long would you lay out?
I would wake up at like 8 a.m. and lay out until noon, like every day in the summer, because, 10 to, what is it, 10 to 2 is like the best time to be in the sun in my mind, because that's when you can get the most tan. But the fact of the matter is it's reverse. It's like 10 to 2 is the worst time to be in the sun because that's when you get the most sun rays and the most damage.
So who found the melanoma?
A mixture of me and my dermatologist and my family and everybody, I guess. It was on my shin. And so in the summer, when I was laying out, me, my friends, my family, like people would point it out because it was getting big in size, shape, diameter. It was dry, crusty. And like people started saying, yeah, you should probably go get that checked out. And I'm like, yeah, I probably should. But it was around 2019, 2020 when that happened, when it began growing in size, shape, and diameter.
So
Yes.
2020, you didn't go for your annual. Now,
Yep.
was this a new mole or was this an existing mole?
It was an existing mole and it was more like a very small freckle. It wasn't like anything serious. It was a flat freckle that I had on my leg forever, but it just started growing.
And right, and then 2020 with the pandemic, you obviously could not go get it checked out. So
Hmm.
in 2021, how long after you noticed it that you went in and got an exam or had it evaluated?
Yeah, so in 2021 in June, we went on vacation to Columbus Zoo in Ohio, and it's like a water park too. They have a huge water park. And so I was in my bikini, and this big, shiny, brown mole was on my shin. And at that point, it was like the size of a dime or a nickel. It's pretty big. And my mother-in-law and my fiance at the time, my son's father, he was like, "You should probably go get that checked out. It looks really bad. You really need to go get that checked out." And so I remember the first thing I did once we got home from that vacation is finally call my dermatologist and say, "Hey, I need this checked out."
How long did it take you to get in? Did you get in right away or
Right
did
away.
you right away?
Yeah.
Good,
Because
good.
I explained it, and I think they probably knew that they
Okay,
needed
so
to get
you
me
were an
in.
established patient. It was a little bit
I
easier.
was.
You didn't
I
need
was.
a
I just skipped
referral.
that one skin check.
Yeah, so it's interesting that you mentioned that you got insurance and that kind of prompted you to go get medical care just in general. Do you feel that, concerns of cost is an issue in regards to going to get a full body skin check?
100%. Yeah, I never would have done it had it. I never did it. I didn't. It took for me to get insurance to go do it.
Yeah. Was Medicaid a little bit more difficult to navigate in regards to finding a provider that took Medicaid?
Honestly, no, no. And I still have it today, to be honest with
Okay.
you, and it's been fantastic.
Okay, because I know, the practice that I was at previously, not a lot of dermatologists took Medicaid,
Mhm.
and it took some time for them to be seen. However, I'm a physician associate assistant, and we would be able to see that patient within a week, and a lot
Mhm.
of times that could be life-saving. But I want to ask you in regards to when you did get the diagnosis, how did that affect you emotionally and socially at the age? Because you were 27 years old at the diagnosis, right? At the time of diagnosis.
Yeah. I still remember not taking it seriously initially when I walked into the dermatologist office and he asked, "Do you have any concerns?" And I whipped out my leg and showed him the mole. And it took him 2 seconds to say that's melanoma. So he didn't even wait to take a biopsy. He did take one, but he told me that's melanoma. And I was like, what's melanoma? Even though I had skin checks before, it's like everything went through one ear and out the other until I was actually diagnosed. And then once I was diagnosed, I remember coming home and being like, well, I was told today that I have the deadliest form of skin cancer. And it just didn't feel real at all because I was 27. I
Did you
But
continue tanning?
kind of. It took a few months for me to get the surgeries and get the wide local excisions, and they found it in my lymph nodes for me to finally realize, yeah, this is serious. So I would say it was diagnosed in like June. October is whenever I had my surgery. It took that long for me to stop tanning and realize that this is real serious stuff here.
And I hope you're not tanning now.
No, no, I love my sunscreen. I self tan. I'm very pro self tan. I still like a little glow,
Sure, sure.
but no, no, no. And now, even going outside without a hat or without sunglasses, or this is a UPF shirt that I have on right now because I'm standing next to a window, like gives me anxiety.
Okay, so what advice would you give clinicians when educating young patients such as yourself about melanoma prevention?
Yeah, it's hard because young people do have that it won't happen to me tendency. So if you do have actual stories of real people my age that you can pull from, you can tell those true stories. But also, I've learned that s- being in this community now, it's not like it used to be back in the day. The sunscreens don't smell like that typical sunscreen goopy that it used to be. There's so many beautiful sunscreens that are completely clear, don't have that typical scent, UPF clothing is cute, hats are trendy. Like it's not this, it's not what it used to be at all.
Right, right. And then you are a huge advocate of bringing melanoma awareness um, to your platform on social media. And of course, through the volunteer work that we do together at Don't Friday
Mhm.
for the National Council of Skin Cancer Prevention. And can you share what you're doing to help educate people on the importance of skin exams, skin cancer, and melanoma prevention?
Yeah, I've taken the approach to using social media to just show the raw truth of the day to day of what it's like to be a skin cancer patient. So I don't really filter anything. I don't hide anything. I just let people watching follow along my life, my day-to-day life of what it looks like. I don't try to make it look sweet. I don't try to make it look funny or I just try to be as raw and vulnerable as possible. And I've found that it's the best way to connect and make people see with their own eyes that it's not just skin cancer, which is what everybody says at first. Oh, it's just skin cancer. You just cut it off and you move on with your life. It's nothing like that. And I just feel like the rawness of it has really made a difference in people who follow my story.
Absolutely. So you had treatment for the melanoma. Can you tell us a little bit about that journey, about the diagnosis, excision, the lymph node, any kind of other treatment that you went through? Can you share that with
Mhm.
me?
Yeah, yeah. Once I was diagnosed, they biopsied and removed it right then and there to send it off for testing. And a common thing with that is you can't always get clear margins when you're just cutting it out with the eye. So the sample that they sent in didn't have clear enough margins around the mole to be safe enough to be like the full cancer to be removed. So I had to go in for a second surgery where they had to take a wider section of my leg out. They had to close it up with a skin graft during that, and that's the wide local excision. So that's a common surgery after melanoma, just taking out more. And during that same surgery, they did a sentinel lymph node biopsy. They found melanoma in one of my lymph nodes in my groin. So it had just began traveling internally through my body when it was found. Because usually it can be in like many different lymph nodes. For me, it was only one, which I find that lucky. So they removed that one lymph node. And because it had spread to my lymph nodes, I was encouraged to do a year of immunotherapy with, I use Keytruda, and that was every 3 weeks for an entire year. I had to go in and have infusions at my cancer center.
Mm-hmm. And how did you tolerate that? Was that tolerable for you?
No,
It
the
was a tough journey.
immunotherapy was honestly the worst, hardest part. Not even the cancer itself caused as much issue as the immunotherapy did. So it's like a double-edged sword because the immunotherapy is proven to help prevent melanoma from returning. And if it does return, to teach my body to fight it off like it should have in the first place and didn't. So that's a huge positive. But I suffered huge side effects from the immunotherapy that took 2 years to, it took a year to do the immunotherapy, and then it took 2 years to feel back to normal and healthy again after the immunotherapy.
Yeah, but you're glad you did it.
I am. I
You're
often think to myself, like, if I were to go back and be told to do immunotherapy or to not, would I do it? I still think I do. I think I
yeah.
would.
Yeah.
Yeah.
The unknown. Was cost ever a concern during that time with the insurance, with the coverage of a new therapy like that?
Luckily, no. Had I been diagnosed with melanoma just a handful of years prior, that would have been an issue because Keytruda wasn't covered by insurance quite yet, just a handful of years before my diagnosis. But luckily, I was diagnosed in a time where I had no issues.
Is there anything that dermatology clinicians could have done differently to improve your understanding of skin health before the diagnosis?
Yeah. I remember like during my skin checks, they would tell you about the ABCDs of melanoma. They would send you a card home. And I would not really like read that stuff, and I know it's their best intentions, but if they could have just sat there with me and like pointed out moles that may look concerning and at least taught me what to check for at home myself and encourage me to, or just taking the time, I guess, to teach me how to do a skin check at home and exactly what to look for and how to perform one. I feel like that's something that I could have tangibly took home with me better than just a brochure that
Yes,
told me how to do
that's
it.
interesting that you say that because now there are tutorials on the Skin Cancer Foundation, Melanoma
Mhm.
Research Foundation, AMET Melanoma, and others to teach people how to perform a skin exam. And I think that, again, resonates with what you just said. It is
Mhm.
needed. The question is, do you think people will go and actually
Yeah.
look at it?
And I do them now, of course, but I'll tell you something, to be honest, when I was diagnosed, I lost my dad young and I kind of put the whole medical system in the trauma bucket with it. So when I was diagnosed, I told myself that I didn't want to trust the internet because the whole thing with, you Google something and it always is cancer and you're always dying. So I made a vow to myself to just trust my doctors. Don't go on the internet. Don't go searching for answers for things. Like I wanted to trust my healthcare team and not be influenced by potential misinformation that I could find on the internet. Because if you go searching for something, you'll find it, whether it's right or wrong.
Uh,
And I kind of wish, to be honest, I would have done that searching on the internet because if I would have found the Skin Cancer Foundation sooner, if I would have found Melanoma Research Alliance sooner, I would have found a community of people who are aiming to give the best information to patients and caretakers and survivors. And
I
a
love that
lot of
you.
things would have been prevented. I had a lot of doctors, like, for example, when I was in treatment for immunotherapy, I was starting to get colitis symptoms, which is a very common side effect of immunotherapy. And my oncologist kept telling me, no, it's not colitis. She's never heard of colitis. And if I would have just went online and fact checked that, I could have went back to her and said, yes, there is actually research that says colitis is common and my symptoms are matching it exactly. Can you please like take it seriously? Because I
Yeah,
ended up damaging my pancreas, getting a pancreas attack, and having colitis for 2 years past treatment because of it, which is one of the things that immunotherapy caused that was worse than the cancer.
that's very interesting that you say that, Brittany, because I feel like a collaborative approach in the clinic is so important in regards to really listening to the patient and understanding their symptoms, but also working together as a team. And if you did your research and you brought that in, and again, we can't know everything, of course,
Mhm.
but everybody is different in regards to responding to something. And even though a symptom can be common, somebody could be very at the extreme end versus somebody who's very mild. But I
Mhm.
think what you're saying is that collaborative team approach with your provider is so important.
Absolutely.